Hello, Dr. Chludzinski here, Fanwood local chiropractic and back and neck pain specialist. We have George with us today. George is going to be receiving a chiropractic adjustment. He just got done with some cervical decompression on his neck. George originally came in because he had some neck pain, referring to his shoulders, upper back, and he's been coming in for a few weeks now. He's been feeling much better. Right, George?
Yep.
Excellent. Can you just lay face down? Sure. So with George, we're going to be working on his muscles. Doing some myofascial work, removing any restrictions to the muscles. We're also going to make sure that all the joints in the upper back and neck are moving properly. What I'm doing here is just assessing, just static palpation to make sure that everything is gliding well, everything's moving properly. There's a few areas that are a little stuck. George is an electrician, so he puts his body into awkward positions, a lot of over the head reaching stuff, so it does places a lot of stress and strain on the upper back and neck muscles and nerves. Okay, the first thing we're going to do is we're going to loosen up the muscles a little bit. We're going to apply some pressure to this muscle, and we're going to do what's called a pin and stretch. I'm going to pin that muscle and stretch it towards the normal range of motion, making sure everything is pulling symmetrically from right to left, and everything's gliding properly. And we're going to shape this scapula down here. Good. Good. Excellent. And we're going to do the same thing on this side. What we do is apply a little bit of pressure. It's not really painful. We're making sure that all restrictions are removed and that the muscles glide properly. Excellent. And relax your arm down here, George. And we're going to use a vibropressor. The vibropressor helps to increase circulation to the muscles, loosen up all the tissues surrounding the spine. It feels actually really pretty, good. Loosen up the muscles, draw some blood, water, nutrient, all to the surface here. And we're going to do the traps and the paraspinals of the thoracic spine, all the way down to about the lumbars. Addressing the whole lat muscle and deeper muscle tissues. If you find an area that's tight, we're going to apply a little bit of pressure, hold there for a few seconds, go a little deeper. Now we're going to put some movement to the spine with the adjustment. These bones moving around. Any areas that are restricted or not moving properly, we're going to apply a force here to get it moving. Take a deep breath in for me, George. All the way out. Relax. Good. And again, excellent. Again. All the way out. Relax. Perfect. One more time. All the way out. Excellent. And reassess that. Better. Okay, flip over to your back. And we're going to do the same thing as neck, make sure those bones are moving properly and good alignment. If we find anything that's out of alignment, we're going to move those bones into the right position. First, we're going to look at some of the muscles here. Same thing like we were doing in the upper back, applying some pressure and moving that muscle to its range of motion. Okay, George?
Yep.
Here, just like this. Opening up the trap. These muscles get shortened, especially when he puts his body into different positions at work. Now that everything's assessed, we found areas that are not moving properly. We're just going to go motion here and get it moving well. Loosen up, facing that way. Just straight ahead. Now we're just going to reinforce his posture. He spends a lot of time, like we said, with his head in forward flexion, so we want to mirror image that. So what we're going to do is we're going to place his head into a little bit of extension. I want you to bring your shoulder blades together, just like that. And we're going to do a little stimulation. The muscles and nerves here, this sends good input to the brain. Send the message back down to his postural muscles to help balance all the awkward positions he puts his body. Back to center. How'd that feel, okay?
That's good, Doc.
All right, we're all set for today. Please join us again on another video. Have a good day. Thank you.